Hello, this is Dr. N.K.Saha. I'm going to speak to you regarding breast tumors. Now, the most important thing that I would like to say to you is this, that whenever a question of breast tumor comes, we all presume that it's a female disease. But let me be very honest to you, males are also affected by breast tumors, though rare, but they are also affected. Secondly, the other myth regarding breast tumors are that whenever a breast tumor is found, everybody thinks that it's cancerous or it's malignant and it's a bad thing. This is the second myth. Now, this is almost sure that not all breast tumors are known to be cancerous, and there's a wide number of breast tumors which are non-cancerous and which can be treated with medical management also. Not that every breast tumor needs an operation. Now, let me focus mainly on the benign conditions of a breast. I mean, the benign tumors of the breast. Now, regarding the benign tumors of the breast, there is a new term that has been evolved over the years now. We call it ANDI, A-N-D-I. Now, ANDI means it's an aberration of normal development and involution of breast tumors. In very easy language, it means that the normal development of a breast and its involution goes into an aberrant change or an alternate kind of change, abnormal change. So that is why many females do present with breast tumors. Now, the normal benign breast tumors are you have nodules in the breast. Nodules in the breast, there are cysts in the breast, and there are fibroadenomas. Now, nodules in the breast, normally young age female who have just attained their, who are in the late teens, they normally are affected by it. And fibroadenoma, another normal benign tumor of the breast with very unlikely malignant transformation out there. I mean, it hardly becomes cancerous. Those are the initial ones that you normally see. The patients normally present with a lot of pain in the breast and a feeling of lump in the breast. There are other breast cysts of the breast. Now, this breast cyst and the nodularity of the breast, these are all can be treated absolutely with medical management. There is no need for any surgical management for the same. In fibroadenoma of the breast, it's a benign condition. That means it is not a malignant condition, and it can be easily excised in due time. And patients normally they do good with that. A few times it also comes back recurrently. But over the time, we have seen that it being an aberration, again, I'm coming back to the term ANDI. It being an aberration of a normal breast development, there are times that in due course of time, when the patient starts breastfeeding and all, these changes in the breast, they normally come down. So the initial message from the talk is that whenever there is a breast tumor, don't have a panic attack and don't get worried about it. It might be a benign one also, and it's not that all of them are cancerous. Of course, breast tumors which are cancerous needs to be treated early. The earlier treatment that is being done, and the modalities of treatment now are extensive and adequate enough. We have all the 3 modalities of treatment for a breast tumor that is cancerous. We go for surgery, we go for chemotherapy, and we go radiotherapy. Then we have patients whom are on long-standing oral chemotherapeutic drugs. So with the newer advancements of chemo, radiotherapy, the patients normally do good. The overall age expectancy has also increased a lot, so long the breast tumor has not spread into the whole body. So it's essential that whenever you have a breast cancer and if it is diagnosed early, it normally has a very favorable prognosis. Not all breast cancers needs to be operated in a way that the whole breast has to be removed. Nowadays we have breast conservation surgery also, where the breast is conserved and only the tumor and a part of its wall and area it's removed, which is followed by chemotherapy and radiotherapy. Now the breast conservation surgery is normally advocated or used in patients who have a very small lump. That is why again I go back to the same topic that we should, any patient who has a breast tumor, and if it is diagnosed early, the prognosis of overall treatment and expectancy of life is also very favorable. So it's a brief about the whole breast disease that we see, and in male breast also there are chances of malignancy coming up, so it has to be treated in the same way as a female breast cancer is done. Then male breast do also suffer from something, a term called gynecomastia, that is an abnormal enlargement of the breast in males. So these are also surgical procedures where the enlargement of the breast can be brought down to its normal size. So overall the take-home message is, whenever you have a breast tumor, don't panic. Get a good high resolution USG ultrasound done, and if necessary for an aged female, a middle-aged female, a mammogram is also a good test, a toolkit for it to be diagnosed. And then the final one is to do an FNAC, that means a needle aspiration from the tumor, which normally helps us to diagnose whether it's a benign one or a malignant one. If it is found, see a doctor immediately and get it treated immediately. Okay, thank you.